Can reveal more than 700 people who tested positive for COVID-19 waited up to 4 days to receive medical assessment when it should have happened in 24 hours.
Health authorities say they're making changes, but concern remains the delays are putting lives at risk. Investigations reporter Michael Morra has this exclusive story.
There are currently more than 2,000 people isolating at home, including 538 people with COVID-19. Rapidly contacting cases to assess medical issues like pre-existing conditions, living conditions and their age is critical. Contact is supposed to happen within a day, but hundreds have faced delays.
I think it is a big issue. We know that people with COVID-19 infection can deteriorate very rapidly, and there have been some tragic examples of people dying at home.
Between 17 August and 18 November, more than 5,000 cases were given a medical assessment within the desired 24 hours. 480 people were interviewed within 2 days. For 122 others, it took 3 days for health officials to do the assessment. In 61 cases, it took up to 4 days, and 68 people were not contacted for 4 days or longer. That means 732 people faced delayed medical assessments. National's Chris Bishop obtained the figures and says any delay is dangerous.
That's extremely concerning because everyone who waits longer than 24 hours for that medical assessment is potentially at risk.
Professor Baker says no one should wait longer than 24 hours as COVID can quickly cause confusion.
One of its big effects is reducing respiration efficiency. So you start to get short of oxygen, and when that happens, people's judgment starts to deteriorate, so they won't know that they're actually going downhill.
There have been 2 potentially preventable deaths in home isolation, and as Newshub revealed last night, a 3rd person who died at home also received substandard care with no clinician calling him back despite low oxygen readings. Healthline has 100 to 150 non-clinical staff doing daily health checks of COVID cases at home. They are supported by 30 clinical staff made up of registered nurses and paramedics. Doctors are used sporadically, but GP involvement might expand.
There is a possibility as the new year rolls out, depending on the volume of cases and what's actually happening, that GPs will possibly become more involved.
Health authorities could not say if all medical assessments are now being done within the 24 hours, but said since the preventable deaths they have focused on ensuring rapid access to clinical assessments, public health assessment, social services support and oximeter delivery to everyone in home ISO.
The system was not ready to go, and unfortunately it still does not look like it's scaling up to the way that it should be.
And scaling up is exactly what's needed as we head into the holidays, borders open and Omicron looms.
And Michael joins us now. And Michael, you've learned of a separate issue relating to expired vaccines.
Yeah, Mel, the Health Ministry has confirmed to me that 2 people have mistakenly been given expired vaccines, one in Auckland and one in Wellington. The Health Ministry is calling this human error, but as a result, vaccination and immunisation authorities have sent out a reminder to all vaccinators around the country to check the expiry dates on vials as they prepare the vaccines. Now, more than 3.7 million New Zealanders have been double vaxxed, and so these incidents do appear to be very isolated, Mel.
Michael Morra, thanks for joining us.